My name is Emma Nieminen, and I work for the Nightline Association as their Suicide Calls Project Coordinator. So for my showreel today, I wanted to provide an overview of the essential role that Nightline services play as part of the higher education student wellbeing package, and to showcase how we are continuing to improve that service provision 50 years after our inception. So let's get started. So Nightlines are a non-advisory listening and information service. Just to give you a little bit of a background in case you're not familiar with what a Nightline is. And they provide peer-to-peer active listening support to students in an anonymous, confidential, and non-judgmental manner. Nightline services are really crucially open during the night when other university support services are usually closed. Research that was conducted in 2013 showed that a third of UK students who had experienced emotional distress during their studies explicitly remember that occurring at night. So the vision of the Nightline movement is that by being able to talk about their feelings in a safe space, ultimately fewer students' education will be compromised by emotional difficulties, and that ultimately fewer students will die by suicide. So I guess as an overview, Nightlines offer an evidence-based resource that allows students to be supported and heard by their peers who have a shared understanding of their experience. So what does this service provision look like? At the moment, we have 37 Nightline services across the UK and Ireland, which are all supported by the Nightline Association as their umbrella charity. As you can see on the map, 8 of these services are currently located in Scotland, and they cover over 14 different institutions. So these services provide support to actually over 87% of the higher education student population in Scotland, which, if you're counting, is over 220,000 students. All of this is achieved by approximately 500 student volunteers in Scotland who give up their time to do overnight shifts to support their peers. So what these Nightlines do is provide that mixture of listening and information support, and the way that they do this is either over the phone, online instant messaging, text message, email, and some Nightlines even have an in-person drop-in service. And just as a recap, those core principles of Nightlines are to be confidential, anonymous, non-judgmental, non-directive, and non-advisory. So when it comes to contacting Nightline, I've told you a little bit about the methods in which students can use to get in touch. And they can really contact about any issue, no matter how big or how small. So the graphic here on the slide shows call data from 30 different Nightlines from the 2017-2018 academic year. And although we say call data, we use this to mean any form of contact that I've just told you about. It's just easier to kind of lump all of that in and refer to them as calls. So this hopefully gives a little bit of an indication of the variety of call topics and methods of contact as well. So in this academic year, Nightline volunteers listened to over 30,000 calls, with phone calls lasting on average 26 minutes and instant messaging contacts on average 56 minutes. What I'd like to draw your attention to here is the fact that approximately 5% of these calls, which is over 1,400 contacts, mentioned either suicidal thoughts or suicide attempts. Now, this was a 74% increase compared to previous years, and calls mentioning suicide increased the most in comparison to any other call topic. So this stark increase prompted the Nightline Association to seek out specific funding for a project to provide further training to our affiliate Nightlines on this very difficult call topic. But before I tell you a little bit more about this funding that we sought out and the project that we started, I first wanted to give a little bit of context around Nightlines and their practices when it comes to suicide. So the Nightline movement, like I said, is celebrated its 50th anniversary this year. It was started at the University of Essex in 1970 and was greatly supported by Reverend Malcolm France and Professor Geoffrey Hosking, who were both Samaritans volunteers and were working at the university. And the first Nightline training was actually delivered by Chad Vara, who is the founder of the Samaritans. So Nightline's practices around suicide calls are similar to that of the Samaritans in that trained volunteers listen without judgment or providing advice, but they can offer to call emergency services on the caller's behalf if they ask for that. Or they can also provide information and signposting to other services if that's something that's asked for. So Nightline's training has evolved over the last 50 years, obviously out of Samaritans training, and is similar in structure as well, in that each Nightline branch runs their own training program, which is developed according to the good practice guidelines that are set out by the Nightline Association. So these guidelines ensure that Nightlines are running their services legally, safely, and with a duty of care to both callers and volunteers. So having given you a little bit more context in terms of, I guess, the origins of the Nightline movement and the general, I guess, practices when it comes to suicidal calls, I'll tell you a little bit more about our Suicide Calls project. So when our statistics showed such a drastic increase in calls around suicide, the Nightline Association partnered with the Charlie Waller Trust to create a bespoke suicide calls training package for Nightlines that would be dynamic, evidence-based, and most importantly, relevant for the services that our student volunteers are providing. So after over a year of collaborating with our Nightlines and the Charlie Waller Trust on creating this module, we began delivering this training at the beginning of the 2019-2020 academic year, which involves a kind of 5-hour interactive session that we provide free of charge to all of our affiliate Nightlines. So this training module and the overall Suicide Calls project are an example of how the Nightline Association, as an umbrella charity, can help support the ongoing development and growth of all of our Nightlines when there are common themes that affect all services, like in this case. So our aim for this project was not just to deliver training, but to have a more widespread influence on Nightline practices and overall the confidence and competence of student volunteers. So Nightlines themselves, they run their own training programs, like I mentioned on the previous slide, much like Samaritans, each branch is responsible for their own training. So this is an example of a training program that we created to be more, I guess, consistent across all of our Nightlines that can supplement what they're doing in their own individual services already. So the aims that you can see here, this is what we really sought with this project, was to broaden knowledge and understanding around both suicidal ideation and intent, to increase volunteers' confidence, which is absolutely key part of what we were looking for here, and for volunteers to be able to ask more direct questions around suicide, and possibly even to take part in practices that can facilitate hope within a call, while still doing that in a Nightline context. So how do we deliver the training and strive to meet those aims? This slide shows a really quick overview of the main topics in the Suicide Calls training session that we've created. This training is usually delivered by a pair of experienced trainers to a group of no more than 20 Nightline volunteers. We have a team of 10 trainers who have attended a extensive Train the Trainer workshop delivered by Charlie Waller Trust to equip them with the skills they need to facilitate and deliver this session. And I have to say that they do an incredible job of it, since 100% of our participants thus far have rated their facilitation as either excellent or good. So that sounds really great. So at the beginning of our training session, we set the stage by providing some context and statistics around suicide, as well as looking at, I guess, variations in good practice across Nightlines and other helplines in the sector. We then spend a considerable amount of time looking at the language we use around suicide, as well as busting some of the common myths associated with it. We then consider the differences between suicidal ideation and intent and how these can develop and change over time. Although Nightlines are non-judgmental and non-directive by principle, we discuss in depth how volunteers can facilitate hope during a call without contravening these core principles. We then round off the day by practicing these skills in pairs and having a full discussion on self-care for volunteers to make sure that their welfare needs are taken care of. So the session itself is really quite interactive, providing a mix of information via PowerPoint and the trainers. We have large group discussions, small group work, and obviously that skills practice that's done in pairs as well. So this all ensures that we create a safe and comfortable environment in which participants feel hopefully able to answer and ask questions, share their thoughts, and hopefully to gain new skills as well. Our feedback from delivering this training over the last year shows that after attending this session, 98% of attendees felt more confident in responding to suicide calls. They also gained new skills and knowledge and felt that they'd be able to use these skills in their volunteering role. So overall, we saw a 51% increase in confidence from before the session to after the session. So that we feel that our first year has been quite a success based on the feedback that we've gained so far. So if we weren't in the middle of a global pandemic, my showreel would probably end here, as we would be continuing to deliver this training Nightlines in the current academic year. But since we've all had to amend and adapt our practices due to the circumstances, I wanted to give a quick overview of how we have altered our project since we can't deliver any in-person training safely at the present moment. Since we've got all this incredible training content, we are working on adapting it into information documents and training guidance that Nightlines can incorporate into their services, as well as breaking down the module into more manageable chunks to be delivered in virtual discussion groups. So not exactly a 5-hour long Zoom call, but more bite-sized pieces is what we're working towards. We are also continuing our research into best practice across the sector and using this to inform the creation of new model policies and procedures as we are carrying out our suicide policy review across all of our Nightlines. We will, of course, resume our in-person training as soon as it's safe to do so, but in the meantime, we are really excited about this opportunity to really embed the principles and elements of this training module into the core of how Nightlines operate. Now, this project wouldn't be possible without the collaboration of all of the various parties that I've listed here. We are so grateful to the Charlie Waller Trust and our other funders, the Matthew Elridge Trust and Accenture, for making all of this project possible. But by also bringing together the Nightline Association departments, our wonderful suicide calls trainers, and our newly created advisory group of Nightline volunteers, which will soon also include some other helplines as well. This all ensures that we are doing our utmost to support and develop Nightlines so that students always have somewhere to turn to. Now, this project is an example of the evolution and extension of the external training support that the Nightline Association has continually offered our affiliate Nightline services through our conferences and other community building events that we have always done. We've previously really valued the inputs from Tender, Connecting with People, and White Ribbon Scotland, and are incredibly grateful for this current funding that allows us to really embed this prior learning further. But that's not everyone. We also need your help. You, if you're tuning in to this showreel right now, you're a part of this project and the Nightline movement too. So our call to action for anyone who has tuned in is to ask you to find your local Nightline, or several Nightlines. and to support them in whatever way you can. Whether that's following them on social media, signposting your peers to their services, or using your position in a students' union or institution to support your local Nightline service, we're asking you to help us collectively champion student mental health and the impact of peer-led support. I hope the showreel has given you a better understanding of how Nightlines are and have always been an essential component of the wider student support network, and why they are of utmost importance in the current educational landscape, especially. If you have any questions or you'd like to get in touch about anything I've spoken about today, please don't hesitate to send me an email, or I will be around on Twitter for the next couple of days of this conference as well. So feel free to grab me on there if there's anything you'd like to chat about. Thank you so much for listening.